Good morning or good afternoon, whenever it is you are watching these slides. My name is Richard Moore. I'm a general practitioner in Somerset, and I'm director of Cital, who are the delivery partner tasked with delivering support for the PGP Quickstart program in the southern part of the country. Broadly speaking, other delivery partners are doing other areas of in the country, but I hope these slides are pertinent to everybody. During the next 10 or 15 minutes, I'd like to go with you how it works, the implications, the 4 modules will be actually offered through the Quickstart program, and what this means for you. There is a parallel offering that I'm sure you've heard of, known as Productive General Practice Process, and that's a bigger program, and the equal slides or the equivalent slides are available for looking to decide if that would suit you better. The Quickstart program is very much around getting action and change then and there as the consultants come through the room, in your practice. This slide works in 2 ways. The productivity of a general practice is wide and varied and large, and we won't seek to work with you to change that, but what we will seek to do is to look at the effort and the processes and the systems necessary to get the output that you are getting, and see if we can make visible any areas of waste where you can make choices to change the way you do things, changing them so that they're quicker, cheaper, better and faster. And the only way we can do that is by eradicating stuff that doesn't contribute. There's enough going on in the practices without us having to waste time doing things that add value for neither patient nor practitioner. And this involves things such as not duplicating effort, not looking for things that are lost, not looking up data that no one's ever going to look at again. Also, I want to have a little think on this slide about the output of this improvement. For our improvement and effort to be productive, we need output and you need to put in inputs. So although it's counterintuitive, responding to practices who are saying it's really busy by saying we'd like you to work harder and free up time to change what we do, the penalty for not changing what you do is to end up getting what you've always got. And I suppose if you've got this far in the slides, you'll be thinking that really it would be nice if you can change some things round. So on these slides, we talk about releasing time, which is known as the Quickstart program when supported by NHS England as part of the Time for Care program, which in turn is part of the 5-year forward view for general practice. It is quick, short, simple, hands-on support over a period of weeks. What that actually means, it is 6 practice visits with 4 group learning days, where the 6 visits are in 2 groups of 3 consecutive weeks, then a group learning day, then another group of 3. The reason it's like this is that many practices tried the productive general practice, but some found it too much, that they actually needed to achieve some quick wins, to achieve some headspace and time so they could get on and do the larger projects that are in productive general practice. It is designed to result in immediate improvement. So in many ways, this works out that the consultant to your practice comes with the answer and you come with the problem, and then together you make the solution, you make the changes in your practice then and there that over time frees up time and gets you home earlier, just that little bit earlier. As time goes on and you do more of this, like every field of human endeavour, you get better at it with more practice. There are 4 modules on offer in this program for the Forerunner waves, and I'd like to introduce these 4. The first is making best use of administration time. And what we do with this during the practice visits is we deploy some standardized tools and techniques to understand what the administration team are actually doing. We understand and make visual by collating the skills that the administration team has to meet these challenges, capturing some volume, and this is perhaps the first time that anyone's actually had a look at what the volume and mass and type of the administration tasks to support the practices is. And this gives us a chance to look at it and go, are we going about this the best way? Are there any ways of changing skill mix? Are there any ways of changing programs? And then trying those out using the well-rehearsed plan, do, check, act cycles to see if we can make improvements for the practice. You'll notice, even as I introduce this for the first time, it's all about our consultant teams working with your teams to make visible what's currently invisible so that you can choose what you wish to improve. This is not an external based system. This is all about helping you get what you want. The next module I'd like to look at is the well-organized practice. And the process here is about the well-researched 5S. And this is for practices or areas within the practice that have a fair bit of stuff, because one of the ways I mentioned very briefly is looking for things that you need. Some might say this is more appropriate to either reception staff looking for bits of paper or nursing staff that have to use bits of kit in the treatment room. But again, you will know within your practice where this sort of answer would match with questions that you have. And it's surprising how much difference this makes, and we have some tools and techniques which we utilize in the group learning days, where just to give people an idea of core, this could really make a difference. And it doesn't really require a big stretch of the imagination if I show you that this was the before and after pictures for a practice that we worked with on this. And you can imagine if somebody wanted something with a patient that was there for them then and there, that the time saved on the picture to the right is is considerable when you consider to the left. And you will know areas that would benefit from this. And the final benefit, of course, is your staff not wasting time looking for things. The third module I'd like to talk about is efficient processes. And this is really a mechanism at looking at the answer of process mapping, looking at the questions that you may well have. To work with you on this, that first of all we'll choose your process. Many practices choose prescription workflow because there are just so many of them flying around. And many times practices have not had an opportunity to sit down in a multidisciplinary team with the receptionists that are taking the call, perhaps pharmacy technicians are supporting some work, perhaps you might have specialist receptionists supporting them, medical staff prescribing, nursing staff prescribing, and it's often had a chance to grow like Topsy. And this has led to inefficiencies, and this is an opportunity to really sort out what you're doing at the moment, what you'd like to get there. In my own practice, I recall very clearly that in the process that had been allowed to grow up, one moment on receipt of a non-pre-authorized repeat prescription, the receptionist would go and check the outpatient's letters, and then the next thing that would happen is the doctors would go and check the outpatient letters. Clearly, we don't need to duplicate that effort. So once we'd realized we were doing it, it doesn't take the brains of a rocket science to decide or to choose not to do it anymore. You see how, again, we always turn this round so that it's your practice, it's your choices. And then we'll work with you to work out how to implement and support the future practice. This is a picture of a repeat prescription flow map that one of our practices did, and you will see that even just 5 minutes work goes, oh, this is a bit more complicated than we thought it was, and then that gives us time to think about any savings of time and effort that we can make. The next module I'd like to talk about is, as it says on the tin, effective emails, effective meetings and reduced interruptions. And this responds to practices who are feeling the stress, that they feel that there's a lot of time being consumed in these three areas that aren't necessarily getting everywhere. It's just that time just creeps up on the number of hours you have to spend checking your email. Those nagging feelings of, well, do we really have to have meetings at 8 o'clock at night? Are we really making progress? And as I frequently say to interruptions and to people who are, wish to interrupt whatever it is I'm doing, would you actually, if a pilot was landing an aeroplane that you were on, would you actually tap them on the shoulder and say, stop doing that for a moment and pay attention to what I want you to do? There's key areas about safety around interruptions which I think are understated. So the benefits of a well-organized email system are self-evident. I like the idea of the less stress. The team meetings, as practice gets more complicated, then there's more work to be done, there's more understanding, there's more strategy to be set. The days of just turning up and seeing the patients are well gone. And within looking at reduced interruptions, one of the techniques we'll go through and to make visible and educate the practice in is this idea of root cause analysis. And this is a very powerful technique, not just for reducing interruptions, but for a whole variety of frustrations, because by modifying the root cause, then long-standing and permanent change occurs. Whereas if one does not address the root cause, then frankly, the system goes back to exactly where it was as soon as our back was turned. And there's no benefit from the effort involved in trying to seek change. Going to, in more detail, exactly the support that we will provide, that there will be 4 group-based learning. 2 of these are before the program starts, so that we can have a chance to come together and go through in detail a little bit more about the implications, a little bit more of the theory and detail behind the program, so that the practices can get themselves orientated and ready for change. There will then become 3 practice visits at consecutive weeks. Now in this program, in the Quickstart program, there's no homework to be done, there's no preparation to be done, so all the work will be done at those meetings. This is unlike productive general practice process support, where there's data collection and to be done in between meetings. So this program is very much for people who want to get a start and are wondering where to start and to obtain traction, and this is the way to do it. There'll then be a group-based learning day in the middle, which is what's going well, what's not going well, and this is often an opportunity for shamelessly to steal ideas off other practices. There is no problem in the practices coming together to work to break problems together. Another 3 practice visits for the second module you choose, and then a wash and brush up at the end. The wash and brush up at the end is actually critical for us, and it's critical for you, because at that you need to demonstrate the data that you've collected, the improvement you've made, and the change in the data. And that's got 2 big constituents that serves, one of which is you prove to your practice that you set out to achieve something and you've achieved it. And that raises the morale, gives a sense of control in an area where, let's face it, it can be very easy to feel out of control at the moment in the practices. Also, we'd ask that you shared that data with us and also with NHS England, so that the wider taxpayer can get an idea that this program is worth investing in the progress is being made, so that we can secure investment in further years for the practices that will pick it up in further years. The support is for 2 modules, so choose 2 out of 4. And I hope at the end of this brief presentation you'll have a feeling for where your pain and discomfort is and which solution would be most likely to meet that. To make this work, you need to commit, you need to invest. There will be some benefits, but the downside of this being on your practice for your benefit by your team is that actually the work gets done predominantly in the practice. So we need the staff available, and the required staff, that phrase is always a little bit difficult. You as leaders in your practice will know where the problems are in your practice, and you'll be choosing modules to help solve those or reduce those problems. You will want to free up time and space for staff to attack those, and those staff may be people who are working in the area. They may be staff who are not optimistic about change. So you might say to someone who feels that actually this isn't going to work, I need this fixed, but that's not going to work. You might say, well, perhaps you'd like to work in the team that will improve it. So that requires a bit of thought and a bit of subtlety. And of course, they need to be freed up. I'm sure no one was sitting around twiddling their thumbs before that started. That's for the practice visits. For the 4 half-day group-based learning sessions, we'd like to engage in the early sessions with leaders. So we often find we're dealing with the practice manager and the lead GP. Although there's not a desperate need or a mission critical need for the general practitioner to attend, we have found that practices who have a general practitioner engage at the beginning and provide a positive input so that they have a positive attitude and they contribute, have a far greater chance of getting success out of the program than those that don't. And of course, we need to agree the schedule of visits. If we don't do this work, it won't work. I've mentioned earlier that we'd ask you please to share your learning at the 3rd and 4th group learning days, and for those reasons. There might be some stuff about sharing with other practices as you come together. We often talk about how half a dozen practices together coming to do half a dozen different things is not half a dozen practices coming together. That's just 6 practices doing different things. And there may well be some stuff about surveys, as you can imagine, about how we did, how you did. This doesn't work for every practice. We think it's right for about 25% of the practices, this and the combination of productive general practice process. This is for people who know there's a better way, who have found that the complexity of general practice has grown on them without noticing, and would like some well-researched processes to get a grip on traction and have a look at what they do and decide if they could do it smarter and quicker. And this is the feedback from one of our practices who had a typical experience. Good luck.